one of the things that I believe differentiates my approach perhaps from other approaches taken by healthcare executives throughout the United States is the use of lean as a vehicle, not just for performance improvement, which is how people typically look at lean, but also as a way of organizing daily management and as a way of improving and galvanizing the culture of the hospital. And let me talk about each in turn. So first, let me talk about lean as a process improvement tool. This is how we typically understand lean. So the major focus of lean is the elimination of waste and the development of standard work being defined as the best, least waste way to accomplish a goal or to accomplish a particular task. So let me give you a couple of examples of what we've done here at Mount Sinai St. Luke's. So one, we noticed in reviewing our data that we had a significant time period between when a bed was requested in the emergency department for a patient that needed to be admitted and when a bed was made available on the units for the patient to be transferred up. And there's a whole number of different reasons why this was the case. And what we did was we undertook a lean process. In this case, it's called a Kaizen, which is what's referred to as an improvement event. So we undertook this improvement event. And the improvement event involves between 5 and 9 people from different parts of the organization who are dedicated for a week to identifying the problem that needs to be solved, identifying a set of experiments to run to see if these experiments will help to solve the problem that's been identified, and then running the experiments and seeing what the results are. And to the extent that the experiments lead to a positive result, implementing new standard work related to that positive result. So in this particular case, we undertook an improvement event. We redesigned the workflow from the request for a bed to when a bed was made ready up on the unit. We eliminated steps that were redundant or unnecessary. And by doing all of that, we were able to reduce the time it took from when a bed was requested in the emergency department to when a bed was made ready on a unit by almost 50%. I'll give you another example. We at Mount Sinai St. Luke's, when I first got here 5 years ago, experienced considerable challenges with throughput, with effectively and efficiently moving our patients from the admission process through to discharge. This was, as you can imagine, causing a significant backlog, increase in length of stay, and an inability to be able to accept new patients as effectively as we would have wanted. So we did a number of different improvement events and have been able to materially reduce our length of stay. And core to these improvement events, or one of the major initiatives that we've undertaken, is the creation of a discharge command center, which centralized the discharge management process. It's a vehicle through which we identify the patients that need to be discharged, what the impediments to discharge are, and how we can remove those impediments as quickly as possible so that the patients can be discharged timely that day that we've identified them as potentials to be able to leave the hospital. This has allowed us to create significant virtual bed capacity, and by creating significant virtual bed capacity, this year alone, through the first 6 months of the year, our admissions are up by over 1,500 relative to last year. And without having created this virtual capacity, we would not have had the ability to accommodate that type of an increase in admitted volume here at Mount Sinai St. Luke's. So those are a couple of examples of the powerful use of lean to achieve dramatic results in the improvement of our operations. But in addition to the central role that lean plays in process improvement, lean also plays important roles in other areas of and aspects of the hospital as well. The first is that you can utilize lean as a paradigm and as a framework through which to develop your daily management system for your hospital. Most hospitals don't think about the development of a daily management system. Most hospital executives don't think about it that way. But the reality is that just like when you turn on your computer, you need an operating system to make your software work. It's the same thing in a hospital. You need a management system. You need an operating system in order to enable all of your other processes to work effectively and efficiently for the benefit of the patient. So what are some examples of what constitutes a daily management system or an operating system for a hospital? Well, one of the innovations that we've introduced here at Mount Sinai St. Luke's, and in fact throughout the Mount Sinai Health System, are daily huddles. So every day we have a safety huddle. The safety huddle are site-based, and they're preceded by unit-based huddles. And after the site-based safety huddles, we have a system safety huddle. Now, what do these various huddles do? Well, they allow for information to be communicated both from the unit level all the way up to the system level, and from the system level all the way down to the unit level, so that there's effective communication of key information and key operational data up and down the chain of command each and every day in a structured way. Prior to the introduction of these huddles, these tiered huddles, we didn't have that level of effective communication. So that's changed now. What else have we done? We've also deployed what are called huddle boards or daily improvement boards on all of our units. And our huddle boards, our daily improvement boards, include two different components. One component is an area where key stats for the day are accumulated, and key information about unit needs are accumulated as well. So it's really a vehicle for communication to make sure from shift to shift to shift, information is communicated, and if there are safety concerns or other concerns that need to be escalated, that those are escalated to, again, through the tiered huddle system, to the safety huddle or to the system huddle. On the other side of the board, we capture a number of different things, but the most important element of what we capture are ideas from our employees. What do our employees see as ideas for daily improvement? And when we see those ideas, can we do them right away? Can we implement them right away? Can they be implemented relatively inexpensively and relatively quickly? Do they require a large project to be implemented, or are the ideas not practical? For the most part, the ideas are all practical, and for the most part, most of them can be implemented pretty quickly. But the idea is that wisdom resides with the frontline staff, that the people who do the work each and every day know best what's going on in their units, what needs to be fixed, and they have some pretty good ideas about how to fix the things that are broken. What's important in lean is that you need to change the paradigm that exists in most organizations, where management thinks that it needs to be the repository and the sole source of ideas for how the organization needs to be improved and moved forward, and that frontline staff is there to implement what management says. In a lean model, you actually turn that around. What you're looking to do is cultivate the wisdom of the frontline staff, and you do that when management coaches the frontline staff to be problem solvers. We want to create an army of engaged and involved problem solvers throughout the organization. We want people to move from a sense of quote unquote learned helplessness, which is what you see in organizations that don't really work that well, to empowerment, which you see in organizations that do work well. And the way we get empowerment is you create capacity with your frontline staff, and you turn your managers into coaches who are enabling the frontline staff to make the changes in their workplace. It's very powerful when frontline staff believe that they can change the context of how they work each and every day. When you have frontline staff that believe that, you have a far more powerful and dynamic organization than when you have when you have frontline staff who believe that they only have to rely on management to be able to solve their problems for them. We want frontline staff to be able to solve problems. We want management to be able to empower them, coach them to do that. That's part and parcel of what lean brings to the table, what lean brings to an organization, and it's part and parcel of what we want to see in the day-to-day give and take that we're trying to build as part of our daily management and our daily operating system. The third benefit that lean brings to an organization is really cultural transformation. And I was alluding to it in that second point in talking about the change in the relationship between the frontline staff and management. cultural transformation is critically important because the culture lays the foundation for all subsequent change. If you have an aligned, empowered culture, you have the ability to make transformational change within your organization. If you don't have an aligned and empowered culture, you cannot make transformational change within the organization. So lean has the effect of changing the culture, and changing the culture helps to make lean possible and lean effective. So it's that symbiosis between lean as a performance improvement tool, as a process improvement tool, and as a way of doing daily management, and the underlying culture. It's the symbiotic relationship between lean and the underlying culture. That's what really creates the dynamism that separates the powerful organizations, the good organizations, the organizations that are succeeding from the organizations that are challenged. To me, lean works in all three areas. Critically important for process improvement, critically important for day-to-day operations, and critically important for the transformation of the culture. And all three are important to propel any hospital across the country to the next step. And we need to be propelled as healthcare organizations to that next step because of all of the challenges that we're facing as healthcare executives. We are challenged by reduced governmental payments. We are challenged by the aging demographic in the United States. We are challenged by the fact that we've got to figure out, we have to be part of the way in which the country goes after solving for the fact that costs continue to go up in healthcare far beyond the rate of inflation in the rest of the country, so that healthcare is taking up more and more of our precious dollars. We need to be part of that solution. We need to be coming up with ways in which healthcare can be delivered at a high quality and the cost curve be bent. One of the only ways to do that affirmatively as a healthcare provider is through the use of a tool and an approach like lean, because lean affects how healthcare is delivered, lean affects the cultural context of the delivery of healthcare, and lean affects the day-to-day operations of healthcare providers.